At Lagos Television, it's all about storytelling. And when others are silent on the issues bothering on the center of excellence, we remain committed. You're watching Lagos Television, the voice of Lagos.
Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Murupe. Today on the program, we are trying to look at tetanus in children. It remains a public concern, and children, especially newborn affected by this condition, die within the first month of life. Stay tuned. The conversation begins after this break. The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Oluwabumi Oshinubi, Senior Registrar at Massey Street Children's Hospital, Lagos Island, and member of the West African College of Physicians. Thank you so much for joining us this evening, Dr. Oshinubi.
Thank you. Good evening, Dr. Good evening, Olasumbo, and good evening, viewers at home. Thank you.
Tell us, what exactly is tetanus, the tetanus infection now?
Okay, so tetanus infection, also known as lockjaw, is a non-communicable, vaccine-preventable infection. It's actually a serious and an acute infection that affects both nerves and muscles, and this infection is caused by a spore-forming, toxin-producing bacterial organism known as Clostridium tetani. It is also of note to note that, as I said earlier, that this infection can actually be vaccine preventable. It is of note to also know that worldwide children are more affected, especially the newborns are affected, and this is all because their mothers are not well vaccinated. And children, of course, in their infancy don't get to also, some of them also don't get to have their vaccines, or they don't complete the vaccines the way they should, and also get booster doses.
Okay, so before we look at the root causes of tetanus now, tell us, to a layman, what are the things that causes, are there anything that, you know, the risk factors now?
Okay, so this organism is actually found usually in the soil, in dust, also could be found in animal feces and occasionally even in human feces. And these feces could be transferred to objects or substances where people could touch. And then once there's a breakage or in the skin, there's an abrasion, and then this organism gets into it, of course, it starts to start multiplying and form its spores. So actually that is how people get it. Because of the fact that we are in a low resource country where our environment, you know, the way our people live, people are still not so conscious of their hygiene, so much so like that. So we still tend to have it more in our environment. You can also see it in manures around because animals too also carry these organisms. And once the spore is formed, really, and it matures to start producing the toxins, anyone that either steps on it and there's a skin abrasion and the organism finds its way in there, it starts to produce its own toxins, and then the person could start manifestation. Incubation period for it actually is between 3 to 21 days, but with an average of about 8 to 10 days. So you could have people start manifesting as early as 3 days. People could start having the symptoms, which is the lockjaw that I said earlier, is the first symptoms that most people would present with before they would now have the spasm. So we would usually say that there's a period of onset, which we describe as the first period between the first symptoms to the first symptoms, like I said, is the lockjaw, to the time when the patient start presenting with spasm. And most of the time, the spasm would start with neck rigidity, their muscles are stiff, and then they have abdominal rigidity as well. So the patient is not able to open the mouth, they cannot eat, and all. So they have all the symptoms that they will start manifesting with.
Earlier in your response, you explained that the condition is non-communicable. Tell us, how is it fatal, and at the same time, how does it affect the central nervous system? Because from your explanation, it looks deadly.
Okay, so like I said, it is non-communicable, meaning that it is not transferred from one person to the other. That is what it means by non-communicable. So it's not like, because in a family or in an household, a brother has it, the other brother would have it. That's what I mean by it's non-communicable. And of course, it is fatal because it affects the nerves, it affects muscles. So it can affect the laryngeal muscle, which is the muscle that we use to breathe and everything. It can affect it, and so it can cause a respiratory failure. It can cause other complications to the patient. The patients could have some autonomic dysfunctions. They could have fever that could be very high. They could develop hypertension. For some of them, in late stages, they could even have bradycardia, which is a low heart rate. They could have hypertension where their BP is low. And when they start having that, of course, you know that that patient is likely to be towards death. So that's why I said that it could be very fatal. When they have this condition, you are very careful because of the spasm that they are having. And the spasm gets triggered by mere touching even the patients, or when they even hear noises, they could trigger and start having spasm. And spasm could be continuous. So depending on how bad it is, they could have mild, it could be moderate, it could be severe, and you could even have a life-threatening one where you have to put this patient, take over the respiration of the patient, intubate the patient, and take over the respiration and put on mechanical ventilator. So that is why I said it could be fatal and life-threatening.
Okay, before now, we hear people say this person has been hurt by a nail or a metal. tell us, can you please expatiate more on this? How does that affect or bring about tetanus infection in people? Because you also mentioned some other risk factors, death death on surfaces and all that, or in the environment.
Yes. So, like I earlier said, the organism, you can actually get the spore of this organism. It could be found in the soil, it could be found in animal manures, and when people are not well vaccinated and they go around these areas and they have the skin abrasion, of course, they would easily contact it. Also, if someone has an intact skin, but then there's a nail that has been in the soil that is probably either rusted or so, and the person gets to have a nail puncture, the organism, because that nail has been in the soil and this organism can easily be found in the soil, the organism spore can easily get into that skin, because the minute there's a puncture, there's already an abrasion of the skin. That skin is no longer intact. So it can travel easily from there, and then the person contacts it. Also, it's of note to know that neonates can get it from their umbilical cord stump when it is not well cared for, or even during childbirth, when if they use unsterilized instruments to deliver these babies or even the mothers, they could have tetanus as well.
Okay, thank you so much, Dr. Shinubi. Now tell us, what are the symptoms? Some of them you mentioned earlier. If somebody is infected with tetanus, how do we go about it? Is there treatment? Is it treatable?
Some of the symptoms they could have is what we call lockjaw. So the patients have difficulty opening their mouths because the muscles that are surrounding that place are already in rigidity, like I said. So there's a lockjaw, the patients can't open their mouth. Then the facial muscle as well also becomes contracted because of the spasm that is going on there. And so we would say that when that is sustained, they have this facial look that we call a rhizus sardonicus look. They could also have other symptoms like abdominal rigidity because of the spasm that is going on in the muscle. The abdominal muscles are also very hard when you put it looks board-like rigidity. You can't press it down when they're having that spasm. Some of them could have autonomic dysfunction, they could have fever, they could have a fast heart rate, they could also present with a high BP and have hypertension as well. Majorly, it is the spasm and the lockjaw that is one of the things that one would see in them. Aside from if the patient had stayed home long enough that they didn't bring out, and then the patient had developed some other complications that they could also have.
For the newborns, you mentioned earlier that some umbilical cord are not handled properly. We still have some parents, caregivers embracing some unhealthy practices while trying to maintain or ensure the umbilical cord detaches from the abdomen. And we have them,
Yes.
using hot cloth or, hot metals to, compress the abdomen or the umbilical cord. Tell us, what should such people in this category, what would you like them to take away from this engagement?
Okay, so thank you. Just like you said, it is not just them using hot water or hot clothes to burn up the cord. We've seen some parents even actually using this animal dung that we talked about that contains this spore. Some actually put it on the umbilical cord. Some even go as far as using toothpaste on the umbilical cord in a way to say that they are caring for the umbilical cord. But a whole lot of them don't know that most of these babies would actually get tetanus from it, especially if the mother is not well vaccinated or she doesn't even get antenatal care at all. So we would advocate and plead with our mothers out there that cord care is actually with spirit and chlorhexidine gel. And even that chlorhexidine gel, in application of it, should not touch the skin of the baby, because a lot of time when they are applying it, they allow it to touch the skin of the baby and then it gets infected. So you should just clean with spirit and apply that. That is actually the way to go in caring for the baby's cord. They should do that regularly.
Okay, Dr. Shinobi, thank you. Tell us about the treatment for tetanus infection.
Okay, so with
is it treatable?
tetanus, actually say that it's a principle of management. So there are things that you're trying to do in managing this patient. You're trying to stop the toxins that has already been released into the system by this organism. You're trying to neutralize the ones that are circulating, that are still circulating around, and then you are also trying to want to do control or stop the spasm that this patient is having, so that they don't keep on having the spasm. Then you want to do supportive care as well for them. So in trying to stop further spread of the toxins, you want to do wound debridement. So there's usually, most of the time, like I said earlier, there's an abrasion on the skin. There's a breakage of the skin before this will happen. So that is usually your point of entry for the child. So you want to take care of the wound that has caused this point of entry. You want to debride it, because once there are dead cells around that area, it allows for this organism to continue to breed, because it breeds in an environment really where there is little or no oxygen. It's an anaerobic organism. So you want to debride that wound and make sure that you expose and have a fresh area where oxygen, there's blood supply and everything to the wound. You want to, after cleaning that, make sure that the wound doesn't get infected again. Then you want to give antibiotics. An antibiotic of choice here is metronidazole, IV metronidazole, which most people know as Flagyl out there. So you want to give that, because it is an anaerobic organism, and so Flagyl does better with that. Then there are some also that uses penicillin G as well, and IV injections to also to stop the toxins. Then to neutralize the toxins, the ones that are circulating within the body, you want to use the human immunoglobulin, the human tetanus immunoglobulin. So you give that a shot of 500 international units to the patient, so that it will mop up whatever toxins that are still circulating around the patient's body. Importance in this patient, because of the fact that they're having spasm, you can't feed yet, so you have to ensure that their calorie intake is being taken care of parenterally. And then you give IV fluids, you ensure that their environment is safe for them to prevent a fall that can lead to fracture in them. And ensure that you talk to the parents so well, so that they don't feed at your back and allow the patient to go and aspirate the food as well. And before you discharge the patient home, you should ensure that they get vaccinated. You give tetanus toxoid to the patients.
About 11 countries have not met the maternal and neonatal tetanus elimination program set by the World Health Organization. Are people aware of this, and what is the price for not meeting up?
Okay, so yes, even Nigeria happens to actually fall in one of these 11 countries that have not met up with eradicating tetanus or meeting up with the targets of WHO. And this is because vaccination in our environment is not optimal yet. So you still see some of our women that might not even go for antenatal care, or some would go, but they will probably get to go to a traditional birth attendance where they might not get vaccinated, or they will just get a dose and then they might not finish up their vaccines while pregnant. And of course, women of reproductive age group should get vaccinated. They should get the 5 doses that WHO is recommending that people should get to be able to keep them at least immunized, to keep their immunity for a while, at least over a period of 30 years. We are not seeing people do that. And some mothers, actually, because of cultural beliefs, some mothers don't even take their babies to get vaccinated at all. They don't get them to vaccinate them, except maybe when governments are doing the mass immunization that they are going from house to house, that some babies get vaccinated. And most of these house-to-house vaccination that governments are doing is actually for polio, vitamin A that they give to them. So we are actually trying to advocate that people get to take their children to the nearest health center close to them. And government is actually trying in doing this by ensuring that in most of the communities, you have primary health centers close to people, so that you won't say that accessibility to the healthcare center is what you can get. Okay. So people should try as much as possible to key into government's program for immunization, ensure that women of childbearing age group, girls of childbearing age group, get to have immunization, their tetanus injection. When they are pregnant, they go to the hospital, get vaccinated, and complete their tetanus injection. They should actually take at least 2 to 3 doses while pregnant, and then complete the remaining one. And then for the children, they are supposed to take at 6 weeks, at 10 weeks, 14 weeks, and then get a booster dose when they are celebrating their 1 year or 18 months, and then another one at 5 years, and then the next one between 9 and 15 years. So for them to easily remember, we usually say that once the baby has taken 6, 10, 14 weeks, then they should try to get a booster dose for the child at 1 year, which most of us would usually celebrate for the child. Then at 5 years as well, that's also a birthday that most of us celebrate, and a 10-year birthday, so that parents would remember and key to it. They won't forget.
All right, Dr. Oluwabumi Oshinubi, Senior Registrar at Massey Street Children Hospital, Lagos Island, and member of the West African College of Physicians. Thank you so much for your thoughts and insights on tetanus in children.
Thank you, Olasumbo. I'm really very grateful for being here. I appreciate the fact that you are bringing us to here to be able to talk to the people in the community about diseases that we can prevent, and that we just need to take a bold step to make sure that we all do what is right by ensure that we vaccinate ourselves and our children. Thank you.
You are most welcome. Sound Health continues with trending health report from around the world. Please stay tuned. Tetanus vaccine as well as diphtheria, rotavirus are free, safe for your babies. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 00358 to 6603 or follow us on social media at Lagos Television #SoundHealth. A sound health is a sound mind. Make healthy